In order for us to breathe properly, we need to be able to do three things. We need to be able to breathe anteriorly through the front of our diaphragm, laterally through the sides of our rib cage, and posteriorly through the backside of our rib cage. A lot of people who have gone through low back pain rehab or breathing courses are typically very familiar with diaphragmatic breathing, which predominantly focuses on belly breathing. And while that is appropriate, that is not the only way to breathe, and it is not the best way to breathe when we're exercising or performing repeated strenuous movements under heavier load. So first, we're going to look at anterior breathing, which is normal hook line belly breathing that we're all traditionally taught. Then we're going to look at lateral rib expansion, and then we're going to look at posterior rib expansion on the backside of the rib cage. We're going to place one hand on the belly, one hand on the chest. With our tongue in that resting position at the roof of our mouth, we're going to breathe through our nose. Then exhale. What we should predominantly feel is the belly doing most of the work. That diaphragm is pushing the belly forward so that the bottom hand is raising and lowering with each breath. There is very little to no movement in the chest or shoulders. The next step is to find your breath laterally into the side of your rib cage. So what we're going to do is fold a pillow over half. We're going to lay over that pillow so that we can compress the bottom rib cage. While supporting the head, place your hand and your thumb on the back of the ribs, middle to lower ribs. And similarly, you're going to take a deep breath in through the nose. And on that inhale, you should feel your thumb rising laterally and backwards. It should be expanding. In this position, we want to limit how much of that breath comes through the belly and maximize how much of it expands laterally into those ribs. At the top of your breath, you may even feel a stretch along where your hand or your thumb is. The next position we're going to work on is crocodile breathing. This position, which is prone on stomach with a pillow underneath your rib cage and your belly. The table is going to compress the front of the ribs, therefore a deep breath is going to force expansion through the backside of the rib cage. If you do not feel expansion, either you are not taking a deep enough breath or your ribs are restricted and needs to be mobilized. Once we know what it's like to expand each part of our diaphragm, forward, lateral, and posteriorly from the backside, then what we need to do is throw it all together in what we call the 360-degree breath. One of my favorite cues for clients is I like to take a light super band. We're going to tie it around the bottom portion of our rib cage. Moderate tension is just fine. Too heavy and it'll restrict your expansion. From there, as you take a breath, we don't want to feel any particular side of that rib cage, that diaphragm doing most of the work. We want to feel it equally expanding into that band all the way around. So let's do a few breaths for demonstration. I tend to feel more lateral ribcage expansion. I also feel my belly pushing into that band just a little bit, and I can feel some tension in the back of the band towards the middle lower back. Even then, you don't see a bunch of shoulder raising or elevation. That means that you are using accessory muscles to help elevate the ribcage instead of using your diaphragm. This is the most important concept when it comes to bracing while you're breathing during exercise, and something that we need to be mastering before we get into the next phase.